Welcome back to a new episode of Twist of Fate. Today, I'm sitting down with my friends, Kevin and Mena, who are innovators, entrepreneurs in the medical arena. We're here today to talk about POCUS, or point of care ultrasound, and how that can change the lives of patients, medical practitioners, and bring a better quality of life for all of us. So today, we're gonna find out what inspired them to build towards a new standard of care. Kevin and Mena, welcome to Twist of Fate, my friends.
Thank you so much.
Thank you.
Great to be here. Really appreciate it.
Yeah, awesome. So tell me more about how you feel that through ultrasound, a medical professional can see their patients like in a new dimension, like it goes to another level. This is not palpating, right? This isn't just visual observation. Now you really understand. So tell me about POCUS.
Yeah, sure. Point of care ultrasound is kind of like a revolution in bedside medicine. And what it allows any healthcare practitioner to do is kind of digitally peel back the skin and see exactly what's going on in the body. It's kind of like a cheat code. And so any patient who comes to any provider anywhere, really, they're like, my shoulder hurts, or my stomach hurts, or I've got chest pain, or I've got shortness of breath, or my knee's swollen, or whatever the complaint is. And so that professional is trying to get to the answer. Right? That's what we're all trying to do, and from time immemorial, that's what we've always tried to do. And there's this new technology that now allows us to really look inside the body and see exactly what's going on in a way that we were never able to do before, and also kind of share that experience with the patient. So it's not an opaque experience like stethoscope on chest, ooh, you have a murmur, or tapping on somebody's belly. To the patient, they kind of don't really understand or not really involved in the process. And this, where we're scanning a patient and we actually see inside and show them on the screen, wow, this is your gallbladder, this is your heart, this is your shoulder, this is where the problem is. And studies have shown that patients have a way better understanding of what's going on after they've had an ultrasound, and they're way happier with their care, and they're much more likely to follow through with whatever the treatment plan that needs to happen is.
So that makes total sense to me. But for some reason, like, and the audience should know, like, ultrasound is special to me. In my career, I worked a lot for the ultrasound manufacturers. So I would love to see the day that ultrasound is ubiquitous and it's everywhere, but it's not, right?
Right.
So what in your view, like, why doesn't all physicians, all medical professionals, I'm talking not even doctors, like, why isn't everybody using ultrasound?
That's a great question. Well, I would add on in terms of that, the analogy of peeling back the skin. When we think about how medical care is delivered, right? There are multiple layers, and oftentimes that can be really frustrating for both the patient and the provider, right? Traditional ultrasound, right? Ultrasound is a technology. It's not that the technology itself is new. Whenever I bring an ultrasound in the room, whether I'm seeing a male or a female patient, doesn't matter what I'm scanning, I often hear this joke like, is it a boy or a girl, right? And I'm like, well, it's your knee,
Right.
And
pretty
so
ubiquitous in
right,
itself,
exactly.
for sure. You're right about
so
that.
The technology itself is not the new thing, it's the application of it, the point of care piece. And so traditionally, the medical layers, right? You see your doctor, your healthcare provider, and you tell your story, and that person determines, okay, well, maybe an ultrasound will be helpful. So then you go to someone else to get the ultrasound done, usually in another room, with the ultrasound technician who will do the ultrasound. Then, so step number 3, those images get sent to another person, who's the radiologist, who will then read those scans and then send that information back to the original person. So that's a multi-step, multi-layered process, which takes a lot of time.
Sure.
And when medical care is already, it can feel like a behemoth. It's already confusing, and if you are a patient and you're in a vulnerable state, adding on these layers can make it even more challenging, especially when you're navigating insurance, et cetera. So point of care ultrasound is not only taking this technology and bringing it to the bedside, it's doing it in real time. And so I think of it as, imagine taking your car to the shop and someone is just listening to it and trying to figure out what the answer is without lifting up the hood, right? You're like, well, can you actually check this out and see what's going on? You're gonna feel a lot more confident that the person is really getting to the answer. And so point of care ultrasound uses ultrasound technology right there at the bedside as you drive up, or you're driving in with your body, right? And that person is able to use the ultrasound, look inside, and arrive at an answer, and sometimes rule out scary things that you were thinking about. So there's a lot of benefits.
So you already made the segue that gets more special into what you guys do, is competence and confidence and the people part. So what's really inspiring for me, actually, as you can probably tell, that Kevin and Mena are health providers. They're practitioners, not just of ultrasound, but they're physicians. Like, these are smart cookies. We'll get into that. But the interesting thing is, you two got inspired to go out and take POCUS on and to educate people by creating the Global Ultrasound Institute, GUSI. And I think it's really special that you're not stopping at the technology part, because Mena did bring this up. Ultrasound has been around a long time. So the image acquisition part has been around a long time, but the interpretation part is the difference, right? Like, if you didn't have to send it out to other people and you could really understand it and be confident, that's the game changer. That's hard. So tell me more about GUSI. Like, and by the way, like, it's a business, actually. It's an actual business. Tell us more about the business that GUSI is.
Yeah, absolutely. We've been teaching ultrasound for a long time, probably 10 years or more, both in the United States and in Africa and other countries. and so we just ourselves became so much, I feel like, better and more confident providers after we started doing this. And so we just wanted to, there was a lot of aha moments in there and some index cases of like patients that we really were able to alter, in some cases like save their lives, because we used an ultrasound for diagnoses that would have been missed otherwise. And there were just so many moments. I had one particular one in Africa that I'm happy to tell you about, but there are so many moments where, like, wow, this is truly incredible, making us want to like learn as much as possible about this and share it and share that knowledge. And as we kind of went down this journey, we did some initial teaching and opened a lot of people's eyes. And then we realized the further we get down the journey, well, wow, we actually want to make sure that people not only just sort of know about it, but it can actually acquire the skill and make a confident diagnosis at the bedside for a patient who's coming to them for something that is, potentially very serious. It's certainly serious to them. And so we want to make sure that they're as good as they can possibly be with this ultrasound probe in their hand. So which pays its weight in gold, because if you can make that decision in a faster, more timely way and feel confident. Absolutely.
I don't know a physician that's not confident, though. I will say that. But I understand what you mean from a diagnostic confidence.
Yeah,
it's like
because they may be comfortable. They may be confident in something that they've been trained to do in residency or that they learned about in medical school. But in many cases, we're kind of like retooling and retraining a big portion of the House of Medicine, because they didn't get this training, because this really only became possible in large part because of technology that shrunk down these ultrasound machines that used to be the size of like a room and cost $300,000. And now they're a probe that plugs into your smartphone and you can keep it in your pocket and it costs $2,000 or $3,000. So that has really enabled this whole kind of revolution. And really what we feel like is the main gap is that, so now technology has helped solve the problem. Of course, there's always the desire and the demand to get a better, quicker, more cost-effective answer to the patient's complaint and have things be more focused on the patient. And now really the biggest gap is just the education and training, getting folks to a point of like, hey, I know I actually how to do this scan. I can finally see somebody's liver, or I can see their heart now. Great. Now, how do I interpret it? You know, they didn't go to ultrasound tech school. So, and then more importantly, kind of like the third layer is how do I apply this clinically? So, wow, I can see their heart and I can interpret it properly. Ooh, it looks like their heart is not squeezing properly, or it looks like there's fluid around their heart. Now, based on the studies, the evidence, and all this teaching, how do I make a better decision for that patient right sitting in front of me? And so there's a lot there, and that is kind of like what our focus and what I feel like our value proposition is out there in the market, is doing that education and training and truly taking people who want to learn this, you know, really from point A to point B, and point B being I'm confident and I'm competent and I'm going to make a great medical decision, and I'm going to kind of be able to do something that I wasn't able to do before as a clinician.
So this is very much a knowledge intensive business you made, where you're increasing the education bar. So if you don't mind me just asking, so like how many educators like yourselves, like you two are great, but then there's, my understanding with GUSI is like you have this network that you've built of educators.
Absolutely. Yeah, we've got at least 50 to 60 at this point, and we're growing our community of educators around the world now exponentially. We've got educators in multiple different countries around the world: Argentina, Kenya, Malawi, and Europe, all over the United States, Canada. So we're really, really growing, and we're looking to kind of build that community of, and that sort of ecosystem of people who are passionate about it, who are proficient and who are educators of this, and joining those with all of the pool of people who want to learn how to do this.
I mean, it's one thing to be an expert at something, right? It's another thing to be an educator and to be an entertainer. Like, I'm convinced that if it's something is not entertaining, it doesn't stick. Right? And so why should medical education really be any different? And one of the best courses I took in college was an architecture class. And I didn't even take it for credit. I didn't have to keep a notebook. I sat there and absorbed, because it was so interactive. There were images, there were stories. And I think medicine can be taught that way. Ultrasound can be taught that way. And so having GUSI as a platform, being able to create content that's really good. I mean, I've sat in lectures that are engaging. And I feel like even if the content itself wasn't something I was super interested in beforehand, the passion of the presenter, the instructor is transmitted, and I take something away from that. Like I can tell a story about it, or bring it into something I'm teaching in ultrasound, because that, I think, that the ability to really transmit more complex concepts in a simple way, that is a level of understanding of your topic, and being able to do that through ultrasound, something that we're so passionate about.
Sure.
It's just another layer of why we did GUSI.
I agree. I think there is an art form to ultrasound, but even more your point, there's an art form to educating, for sure. Some of the listeners know that I do a monthly webinar with the Chambers of Commerce with the goals of what you said, is to make knowledge accessible. And I think in a lot of ways, what you're describing to me makes sense for those that might be out there. But I have a question for you guys. So my bet is if I took a cross section of the listeners in small business, there's a lot of private practice people that may not be currently using ultrasound. So how would they reach out to GUSI and kind of get in your ecosystem of learning? Like, what is your thought process on? Do they go to your website? Like, they can get a course, whether that be online or live. Like, tell the listeners a little bit more about
Lots of different options. We try to meet people. We try to kind of make it as easy as possible to reach out to people. And of course, we've been in a pandemic for the past 2 years, so a lot of stuff has turned virtual. But we've actually been doing live courses throughout the pandemic. over the past couple of years. We've got live courses. We've got one coming up in San Francisco in April. We've got multiple courses in different cities later this year.
And they can register for that course in San Francisco online. Right?
Online, globalultrasoundinstitute.com. We offer a bunch of individual and group kind of fellowships, so longitudinal virtual mentorship experiences that use teleultrasound, and we review and give feedback on people's scans to get people to that point of confidence and competence. We have webinars. We do a whole bunch of different things that all is going to try to get people to that level of competency. So live, virtual, asynchronous, and synchronous.
That's awesome. Is there particular specialties that you cater to? Because it's not just physicians, right? My understanding,
no.
like it can be other health professionals as well.
Absolutely. I think if you think about ultrasound knowledge as a tree, right? There's the trunk of the tree, and we created a course called the Essentials course that addresses all the content that you would need to in the trunk of the tree, all the basics that you'd need. And then there are other branches. And so we have sports medicine content. We're actively developing pediatrics content, critical care content. And so the branches of those trees, if this is your area, then we have something for
That's
you.
awesome.
But having the trunk of the tree is a great starting point, because there are some commonalities, regardless of your specialty, that you have to have a pretty firm understanding of.
And really any kind of provider, anyone who's touching or seeing a patient or is doing a physical exam or is making any kind of medical decision, if that's a physician, if that's a generalist or a specialist, if that's a nurse practitioner, if it's a physician's assistant, if it's a nurse, it doesn't really matter. Anybody is going to be able to benefit from this knowledge, actually, who's taking care of people. And that's kind of what part of our mission is to really try to empower frontline providers anywhere, particularly in resource-limited areas, but really anywhere, because this is such a huge advance in the physical exams. It's something that we kind of learned in medical school, which is just like the 4 pillars of the physical exam. You're supposed to observe, you're supposed to palpate, you're supposed to percuss, and you're supposed to auscultate with the stethoscope. And honestly, this is the 5th pillar.
Wow. Yeah.
This is the fifth pillar, is to insonate. And because you can actually look inside and see. So really anybody who does any kind of physical exam, I don't care who they are, they're going to be able to benefit from this.
So listening to you, I mean, I, as a marketer, I'm eating this up because I feel that there is some secret sauce in what you're doing. And one of the most progressive things I'm seeing from you both is the inclusive nature to any specialty. And when in the industry trade, like a specialist, I would think is like a physician specialist. But you guys are reaching out to everybody. And I really think that is, like, I'm so into that. Like, I think it's so humble that you guys do that. So let me say this. How did you go from wanting to educate practitioners, seeing a need, worldwide, which is awesome. You guys are well traveled. I appreciate travel. You'll hear about this later on. I travel a lot. But what was the inspiration when you finally said, like, okay, no, we're gonna make a business out of this. Like this is not just like us as a hobby. Like, what happened? Have you guys? Was it you guys went to dinner? You had a drink? like what really? When did you guys go and say, okay, we're gonna call it the Global Ultrasound Institute?
Well, I can't say it was like a drink per se or one event. I think of it as a kind of a stew that several ingredients had been marinating for a while. Kevin mentioned we've been teaching this for a while. The need was clearly there. It was expressed to us directly, and so we went on a walk around the Lafayette Reservoir. So
that's beautiful.
It's
place.
a beautiful
Place.
place, and we talked about things not just in ultrasound and professionally, but also just bigger picture. What do we want from our lives? And what kind of feeling do we want going into work, leaving work? What kind of legacy do we want to leave behind? And so that's really
Keyword
how...
legacy. Legacy. I love
Legacy. And that, I think that's ultimately how Global Ultrasound Institute, and then we were, kicking around different ideas for names and getting a domain on the web, all this started really, I think the marinating ingredients in this stew, we were able to dip the spoon in there and taste it, and on that walk along around the Lafayette Reservoir, and then start to envision the pieces of what we wanted this to be. And it wasn't the details down to the nerves and the little arteries, but I think there's the skeleton. How do we want this to stand? What do we want this to be? What do we want the legacy to be? And so that's, I think it was timing, it was team in our case, timing, team. There were external factors, that being the need expressed, and also the years that we'd already put in and experience that we'd gotten, and expertise to be able to bring something to the world that really believe in.
I think that's very admirable, because it sounds like your inspiration came from a very positive place. You two are very positive people, I can say that. But it's very special that you two, I guess, is it that taking the walk, and to those listening, if you're not from East Bay, this is California East Bay, where the Lafayette Reservoir is. Beautiful place. Is it that you felt like you had to remove yourself from the busy grind, the day-to-day, and that you found common ground, like together, like on this point, that we wanted to start something new? Was it like, because let's just say this, it's a big quantum leap to be a health professional and to jump into the business arena, right?
Yeah, of course.
That's a big jump, right?
I think it comes, yeah, I would agree with everything that Mena said about the multiple components in the stew that are going to come together to make something, special and delicious. There's different, there's like different stages, but such a critical point is that inspiration, that feeling, and then setting the intention after that. Because I feel like we were already passionate about this topic. We'd already been teaching it for a long time. And that, I think, is what you're asking about, is how did you make that leap? And it's hard to put my finger on it a little bit. I would say, just there was an inner drive, something that was compelling me to bring this to more providers and patients than just the ones that I was seeing and just the ones that we were working with at our hospital. And there was something that was, I think, peeling back the layers as I'm thinking about it. So
well, you had business training. That's what you were saying.
So that's what I was saying. Is so before I was a physician, I was a business person, and I worked for some medical information and medical database companies. And because I spoke Spanish, I was able to work in Latin America and spend time in hospitals in Latin America, and then later traveled in Asia and spent a lot of hospitals in Asia. And I realized that was really going to be much more of my calling, was to become a physician. So for the past 20 years, I've been kind of on that journey. And in many ways, this is like a synthesis for me of the two different kind of phases of my life. But I mention that because it's unmistakable, to me at least, when you can feel and sense a true need for something in the market. And point of care ultrasound, as we said, is such an incredible advance and innovation. And so even just on that level, I was just teaching because I wanted to share it with more people. I love medicine. I love seeing patients. I love working with physicians and educators, and I feel like I'm an educator. That's a big part of who I am and my identity as a physician and a person. And so being able to kind of share that with as many people as possible. but there was also the business person inside of me.
The entrepreneur. I mean, make no mistake, you
Yeah.
too are entrepreneurs.
Yeah, the entrepreneur. And, my dad was an entrepreneur. My grandfather was an entrepreneur. So that is alive inside of me. And I just felt like, wow, there is a huge need for this company, which is going to actually take people to a level of confidence and competency, A, and B, to take point of care ultrasound out of the hospital and the emergency department, where it is at this point almost like baked into the specialty.
Absolutely.
But it's taken 25, 30 years for that to happen. Take it out of the hospital, the ICU, and the ER, and bring it to general practice, family medicine, outpatient primary care clinics, federally qualified health centers, resource limited settings all around the world. And there was kind of nobody who was talking to any of those people. And actually, in my mind, those are the people who stand to benefit the most, because they're seeing patients who don't have a lot of other options. Let's say they're in a rural area. You can't just refer down the street to a cardiologist, a nephrologist, and get an MRI and a CAT scan and an ultrasound. It might just be that primary care doctor and their ultrasound. And that's it. All they have to kind of go on to make a great medical decision for them, because if they're going to send them into the big city, that's like a huge expense. It's a 3-hour drive. They're going to get childcare. And maybe if they can just make a better decision right then and there, they can save that person all that hassle and all that money and all that time and heartache and worry. So I feel like
It's amazing.
so back to the business part of it, there was kind of like the there's a physician practitioner part of me. It made me so much better already at what I was doing. The educator part of me, which said, I really want to share this and do it in a way that is engaging and fun, and it's really going to stick with people. And then there was the entrepreneur inside of me that knew this is a huge market opportunity, and we wanted to be like, who better than us to make it happen. And I would say that one last piece was that I had been thinking about this and wanting to do this. You can ask my family members, but wanting to do this for a long time, but I honestly hadn't found the right person to do it.
Was there any moments that you felt fear of failure, or maybe people would view you differently, like your credibility as, MDs? Was there any moments that kept you up at night? Like, I'm just curious.
Well, I think thinking about moments that kept me up at night, right? There's, you think about losing sleep over something that's stressing you out, right? But there's also sometimes losing sleep over something that's really inspiring you.
Sure.
And you wake up like, ooh, I think I have the solution for this problem. Or, hey, if we approach it this way, I think this is going to really get to the answer faster and better. And I think there has to be some element of a little, like that little nagging thing that sometimes keeps you up at night or wakes you up early in the morning. And in my case, it was the sort of positive. I love sleep, but this is one of the exceptions where there's something that can keep you. This gets me up especially when you've been working on something and solving a problem, and the time passes and it doesn't. There's the whole cliche of like, oh, it doesn't feel like work, but it really, when you're doing something that you're passionate about, it really does not feel like work. It feels like you're building something, a cathedral. Like it's a different feeling. And I would, thinking about doctors and the MD road, it is a takeoff from that, because if you think about what it takes to become a doctor, certainly there's some commonalities with entrepreneurship. It takes a lot of work, dedication, discipline, showing up and working hard each and every day.
For a long time.
For a long time, right? There's the delayed gratification for sure. So I think that's a commonality. And the other commonality is in medicine, you have to constantly learn new things. And
This is true.
Right? You have to, and I think
continued education.
Yeah, you have to continue. You have to continue to learn, and I think the best doctors are ones that approach the profession from a kind of a humble. I know that I don't know everything. I need to continue to learn and continue to ask questions. And so I think there are a lot of commonalities with medicine and entrepreneurship. One difference, though, is that in medicine there is a roadmap. There is a very clear roadmap. You need to take these courses, you need to take these tests, you need to apply for these things. And there are some branch points. Sure, what specialty do I want to do? What kind of, where do I want to work after? You know, those decisions. But for the most part, it's not a mystery of what boxes you need to check in order to get this and that job. Whereas entrepreneurship, a lot of the work is figuring out what are the questions that need to answer, how to best answer them, how to best accomplish that, what kind of team do you need, who is the best person for this and that job, how to deploy resources, and how quickly and in which direction first. So there are I think those are those
translatable skills.
Translatable
There's things
skills.
that- yeah.
Yes, translatable
I see
skills.
it now that you mention it.
Yeah.
I wish it would happen more often. I wish it would. I really do. I mean,
If I can, I agree with everything that Mena said. And if I could just add one thing to your point about fear, it's real. And
you mean doctors are afraid as well?
Yeah.
Is that
Yes, yes, it is real.
Yeah,
We
I
are
know.
actual people, and we feel fear just like anybody else. And so it's not like, you know, when you do anything like this, it's not the absence of fear, but is fear the thing that is holding you back? I guess that's the real question. I remember when I made my shift from business to medicine, I went through a whole process of like a lot of questioning, and it took me a really long time to make the jump. And at the end of the day, I feel like I kind of like felt all of like, oh, well, am I smart enough to do this? I'm going to be so old. Am I really sure I want to do this? Is this going to take me where I want to go? They were all like reasonable questions, but honestly, when I kind of peeled them back, they all had kind of fear underlying all of them. And I think I just took a hard look at myself in the mirror and just said, you know, is that the kind of person I want to be? Like, because I believe in myself, I feel like I can do it, and I'm gonna say, yeah, there's fear, and that's real, but I want to pursue my passion. I want to do something I feel really, really strongly about, and that has taken me to a place that I'm so thankful for, that I just was given I guess I had enough confidence and was given enough love or whatever. You can kind of go far on all that stuff, but basically to say, hey, I feel like I don't know exactly where it's going to lead, but I know that this is something that I really want to do, and a direction that I want to go in as a person. And through my time in medicine, one thing that it also has done, in addition to making me realize that I can learn a whole bunch of new things and operate at a really high level, sometimes on very little sleep, but it also instilled a great level of belief in myself and confidence that I'm able, even in high pressure situations, like perform
It's
really
made you better.
made
I
me
agree
better.
with this,
And I
yeah.
feel like this kind of decision to make a jump like that, what you're asking about, is, I feel, really related to that. Is like, do you want to like maximize the areas that you really are most passionate about in life, or something that you really feel strongly about, or you have a unique gift, or you have this superpower that you want to be able to share in some way, or that you have this dream you want to actualize? Whatever it is, it kind of comes from a deep place inside, and I feel like doing some inner work and listening to that, and then following the dictates of it wherever it might lead you, even if it takes you to a scary place. It's almost guaranteed to take you out of your comfort zone. Of course it's going to do that. But it also will lead you to a place where you're going to be a happy person because you're following your dream.
So this is a common thread I see from both of you right now, that and I'm 100% in alignment. It's not the fear of failure. It's almost the fear of if you don't try.
Exactly.
That can crush you as well, right? And I think, for a lot of my listeners now that are either entrepreneurs, but maybe aspiring entrepreneurs or business people, I think this is one of the great lessons that, Kevin and Mena are teaching you right now, which is, okay, you're so worried about fear of failure, but like, if you don't try, then you got to live with yourself then, and that's brutal, right? That can be brutal.
That's brutal. I mean, I think we've all felt regret, and this to me was in that category. I felt like if I didn't do this, and I was going to feel a lot of regret. And honestly, if Global Ultrasound Institute fails tomorrow, which it's not going to, but even if it does and it doesn't achieve our goal set out for it, I feel like we've already succeeded. Because I just will not feel any kind of regret or like, oh, I wish I could have. Boy, that would have been great. We're like doing it and actualizing it and making it happen right now. And even that in itself is like a win for me and a win for all the people that we're going to be touching.
I think listening to you, Kevin and Mena, one thing that I think it's the sign of a great entrepreneur, you're definitely following your passion here. I have not, listeners, you need to know, notice they haven't brought up making money even once. And I will tell you that no matter what business school teaches you, that it's those that go out to get rich usually don't. It's the ones that go out with the belief to change the world in some way are usually the ones that succeed. So I really applaud that. I was just curious on the world part of it. Now you've mentioned, both of you have really well traveled, right? So was there a favorite destination where you were seeing patients doing ultrasound that really stuck with you? You had mentioned earlier you were in Africa or something. There was something that happened there.
I've spent a lot of time working in Africa, 20 years, and the very first time I went there, I was a medical student, and I was
what part of it?
It was in southeastern Africa, a little country called Malawi. And wonderful place. If you ever it's called the Warm Heart of Africa. If you ever get a chance to go there, highly recommend it. Lovely people, safe country. And I was at a small mission hospital there in the northern part of the country, really remote. And there was a patient that I was, as a second year medical student, I was asked to kind of like round on and see all the patients in the internal medicine ward at that mission hospital. And as a second year medical student, you really don't know all that much, but I was doing my best and trying to ask people if there are questions, my senior people and the people who worked there at that mission hospital. And I was seeing a patient, I'd seen her a couple of days before, and she was there for malaria, severe cerebral malaria, as many of the patients who were in the hospitals for the same diagnosis. And she seemed to be improving, but then this morning I walked into the ward and I saw her, and she was like not responding to me. And before that, she had 2 kids with her, and she was like playing with them and interactive, and but she was very markedly different. Her blood pressure was low, her pulse was high, and we weren't really sure what was going on. We were thinking, geez, has the cerebral malaria gotten so much worse that it's making her brain not function and she's got altered level of consciousness? Do we need to do a spinal tap, what we call a lumbar puncture, to see if she's got infection in her central nervous system? We weren't really sure, and somebody had donated, this was a long time ago, but somebody had donated a laptop ultrasound, one of the early sonocyte ultrasounds. And there was a clinical officer there who I'll never forget, and he opened it up and he showed me how to do a scan, and we just looked at her belly actually with this, because I noticed that her belly was a little bit more full than what I had remembered from the day before, and we put the probe on and it was all full of black. Which is what it's not supposed to look like. Well, in her case, it was blood.
Oh, boy.
Yeah. So it turns out the reason why she was so altered and couldn't respond, and her heart rate was high, and her blood pressure was so low, to the point that honestly she might have died had we not intervened, was because she was bleeding internally.
And you could not have seen that without ultrasound?
I would not have made that diagnosis. I was about to go down, well, we got to do a spinal tap, we're going to add more antibiotics. This is something to do with meningitis. And so once we saw that, I went sprinting across the mission to find the surgeon who I'd come with, who came from our medical school, who was running the trip, and we took her to the operating room. and she had 2.5 liters of blood in her belly from a ruptured ectopic pregnancy that hadn't been caught. And there's a longer story, but no one had, there was no blood bank there, and none of the family members were able to give us blood, so we kind of auto-transfused her through some filters and kidney basins and closed her back up, and the next morning went to the ward, and she was up walking around playing with her kids.
So it saved her life.
Absolutely saved her life.
Look at that.
100%. And she would not be alive today without that ultrasound. So
Very
that's what
powerful.
kind of started me on my journey.
Very powerful. And then from Mena, you travel a lot as well. You'll be able to live overseas for a certain period of time.
I think for me, when I think about ultrasound in a global context, it really takes me back to my own roots. My parents are Filipino. My parents are immigrants. No doctors and no entrepreneurs in the family. So, my parents are from a small town, an island called Leyte, in the middle of the country. So far from Manila, far from the big city. You have to take a boat to get there. And my grandfather, who I never knew, because he passed away when my father was still pretty young, we don't even know why he passed away, because my father's family couldn't afford to take him to the doctor, and they were up in a more rural area in the Philippines. And he developed belly pain one day, and he was in bed for a while, and then he was gone not too long after that. And so, when I think about his story, when I think about legacy, when I think about what we're doing, when I think about ultrasound and the potential impact that an ultrasound can make in terms of diagnosis and ultimately treatment, there are life-saving situations. And there are also life-bettering situations, right? My grandfather's story, the story that Kevin shared, these were potentially life and death situations. But there's so many more situations that are just better quality of life, better care on a day-to-day basis. It doesn't always have to be the immediate life and death situation. And so by taking this technology and building a platform and supporting technology and education that actually gets clinicians to point B, that being probe in hand, using it confidently and competently, that translates into better care for millions of people around the world.
100%.
And I think my grandfather would be very proud of that.
No, I really applaud you for sharing, Mena, and I'm sorry for the story of your grandfather, but the truth is, back to the key word you brought up, legacy. I mean, you're beating the odds, my friend. I really admire you. I mean, female entrepreneurism is on the rise, but we've got a long way to go. And for you to really bravely, have your culture in the Philippines, leave your family, go all the way, right? Like, this is a real gladiator here, right? You do the MD thing, you're an entrepreneur, and you're a strong female business leader. So I'm really proud of you both, and your pursuit in a global nature of this new standard of care, or your vision of ubiquitous ultrasound that any practitioner can use. It's an inspiration for us all. So let's say any of my listeners, we talked before, you had mentioned they can go to GUSI.com, they can register for courses. Is there a way that they can, I know that you two you've been on a couple of podcasts now, right? You were on Stock for Docs, that's a financial literacy podcast for medical professionals that Dr. Vivetta Lobo, and you guys talked about the business side of GUSI, but then there's also 40 Athletes, which is, Mena was talking about sports medicine. But is there, in terms of how they can catch up with you guys or kind of get into your culture, you two are both based in East Bay, but you have GUSI people like throughout every country, city, like worldwide, right?
Absolutely. Yeah, we absolutely do. We've got instructors that are all around the country. We've got users in now over 25 countries in the world. We've got multiple instructors that are in Africa, Latin America, and growing all the time. And so as we grow as a company, we're going to be doing more and more live events. COVID-19 permitting, of course, but we're doing more and more live events. We've got our whole asynchronous didactic curriculum that people sign up for, and they can learn anytime, anywhere that they want. And then doing our kind of like fellowships and longitudinal mentorships. You can be anywhere. We've got fellows that are in Nigeria, Lesotho, Kenya, Alaska, Argentina, multiple places around the world, Indian Health Service in rural areas all over this country and in Canada. So our hope is really to basically be able to reach some of those people who are our heroes, which are truly those frontline providers who are giving the best possible care that they can to those patients when there aren't a lot of other medical resources around, and there aren't a lot of resources in general around. And those are like really intrepid, brave providers who are going in every single day and just trying to take care of their patients and do what's best for them. And this is just going to empower those people. That's really all we're trying to do, and get them to wherever they want to be in their journey with ultrasound. Yeah.
That's awesome. And we've talked a lot about ultrasound. You guys also are platform agnostic, right? Like, you're very open to any, of my listeners that work in the ultrasound industry. They love you no matter what. Like that you guys are really inclusive, right? Like, it's not just the health professionals; it's also equipment-wise, right? Like, you use you mentioned laptop. There's handheld. There's you guys use everything, right?
Multiple different brands. There's multiple different device manufacturers, and we kind of don't really care which one you use. We just want you to have a probe in your hand and making a better decision for your patient. And so eventually we're kind of moving into more of like a technical solution to like kind of in some way be like a Dropbox for all of those different type of scans, because one of the big things that we do to get people to competency is giving them feedback and reviewing their scans. That's an important part of the journey, and so we need to be able to kind of get them in one place before we can do that.
Big technology project.
Yeah. We're already doing some of that right now, so it's been really exciting, and the other thing.
I mean, this is a big thing. Like the corporations should partner with you guys. Like, in my opinion, like why not? I mean, at the end of the day, expanding the adoption of ultrasound, you guys are singing the same tune there, right? Like, that's what both of you want. They should definitely reach out to you.
That would be wonderful. We'd be happy to talk to them. It's also, I feel like there's something that's different about what we're doing. It's not just like an initial training here, like here's the machine and this is how you turn it on and this is what a couple knobs do. It's really all the way from that to like, here's what the evidence shows, here's the patient who's coming into your ICU or your clinic who's short of breath and who's coughing, and here's how you use this to make an incredible decision for your patient. And so speaking to physicians and frontline providers as physicians and providers ourselves, and this is what we've been doing. And so we would absolutely love to work with any of those companies to try to like further the reach of this level of education and training.
Fantastic. And then in terms of like for our investor listeners out there, because some of them are out there, you guys are fundraising at this point in time, right? So
we are.
You're pre-Series A, so you're still in pre-seed levels, right?
We are. We've gotten some. We bootstrapped basically all of this over the past 3.5 years, and we've gotten some SBA loans, doing some friends and family, and a couple of smaller investors. But we're absolutely interested, and we've got a real vision, and I think that we're definitely headed for really great things with Global Ultrasound Institute. We've got some really exciting new deals, new plans, new kind of stuff on the horizon for us, and we're super excited about it. But we definitely, as you say, this is a kind of a team sport, and so we're needing a bit of support in order to be able to grow.
No, I'm humbled by you guys even coming and talking to me today. Full disclosure to everybody, GUSI is a client of my company, 3 Steps Forward. And I can only comment, is like, I'm a believer by far. Like, I know that we all will benefit, my listeners, myself, the team in the room here, that if we can help you succeed, all of our lives will be better. So that's sincere, that's real. If anybody the listeners want to get in touch with either of you, like how would they get in touch with you?
Email is great. Mena at globalultrasoundinstitute.com. Kevin at globalultrasoundinstitute.com. And I also wanted to add that, let's say you're not quite, you're just new to learning about ultrasound. This is the first time you've heard about point of care ultrasound. You just want to get a sense for what it is, what we do. We're on Instagram, we're on Twitter, we're on Facebook. We publish lots of really cool, fun cases, a bunch of highlights, new things that are coming out in POCUS. We also talk about our events, upcoming events. And so it's a great way to get a flavor, to join the community and get a flavor for what we do and learn ultrasound and plant the seed,
Awesome stuff. Well, thank you. In the next outings in Twist of Fate, you're going to see more of these type of inspirational stories. But for me today, I think the inclusive nature of GUSI, Kevin, and Mena, and their inspiration of, which I think we all can learn from, which is don't fear failure. You really need to fear, what if you don't even try? And that's the start of the entrepreneur's journey, at least for them and for all of you listening. I hope you find that. Have a good one. Bye-bye.
Twist of Fate is hosted by Doug Younger. It's produced by John Lundvid and Matthew Brown at Ezo Creative. Melanie Filardo schedules our guests. Moni Yu designs our graphics, and Enrique Pimentel manages our digital life. Our theme music is by Jamie Bathgate. Special thanks to all of our patrons. You can support the show by visiting patreon.com/twistoffate podcast. Thanks for listening.